urban sanitation in India is in a crisis. In spite of a rapid urban growth in the country, urban sanitation has not been accorded its due priority and remains highly neglected. It is estimated that about 50 million people in urban areas have no access to any sanitation facility. The situation is far worse in slums, where communities are forced to defecate in the open. This poor status results in significant losses to people and society in the form of poor health and economic losses. It has been estimated that about 23 million children under 14 years in urban India are at risk from diseases due to poor or inadequate sanitation. Governments are attempting to improve urban water supply and sanitation systems and have spent 403 billion rupees. Special programs and projects were designed to improve access and disposal systems. However, the target to reach out to more than 5,000 urban centres remained daunting. Despite the growing attention to urban development, investments in the urban sanitation sector have only increased marginally. Attempts to overcome this crisis are largely focused on creation of infrastructure such as sewerage networks, sewage treatment facilities, and public toilets. Almost half of the urban households have their own sanitation facilities through connection of their toilets to septic tanks or pit latrines. These on-site arrangements remain poorly managed and often exposed to contamination. Only 10% of urban areas have a sewerage network, and cities that have a sewerage system are marginally covered and often cannot dispose of waste safely. As a result, over half of urban households in India could be disposing of human wastes in an unsafe manner, endangering health and the environment. The environmental impact of poor sanitation is significant, and it is estimated that unsafe disposal of domestic sewage contributes to 80% of the pollution of surface water sources. Investments were made without consulting the community and eliciting their participation and ownership. Moreover, as there was little thought to an operation and maintenance plan, limited resources were available for operation and maintenance. Central to all these issues is the lack of awareness among the people about the importance of total sanitation. Sanitation, as private behavior, which affects public health, requires a collective change in behavior. This change is still not clear to all the stakeholders. These were largely unsuccessful as the planning for solutions were addressing only part of the sanitation problem and not looking at the issues holistically at the city-wide level. It is no wonder that Indian cities fare very poorly in global ratings of clean cities. Not that everything is grey and gloomy. Examples of community-led participatory approaches to sanitation are emerging in various Indian cities, for example, in Mumbai, Pune, Trichy, Kalyani, and elsewhere. These approaches involve communities who contribute financially and participate in the planning, design, and implementation of the project. The communities also pay a user charge and at times are responsible for the operation and maintenance of their systems as well. This experience is now widely seen in community toilets in slum areas. These approaches have been facilitated in most cases by the local urban bodies. These successful pilot projects have demonstrated new approaches to mainstream sanitation access and system to the rest of the city through partnership of multiple stakeholders, including municipal bodies, citizens, and support organizations. Today there's an urgent need to target a prudent vision for sanitation in urban India. Cities are made responsible units to work towards transforming urban India into fully sanitized, healthy, and livable cities and towns.